Okay.
Hey guys, Dr. Taylor, Dr. Kayla, and Miss Keisha. We're going to talk about herniated disc versus bulging disc today, and we want to talk about treatment. Most people come in and don't really understand the difference with the bulging disc versus a herniated disc. We like to use the jelly donut. It's the easiest way to describe it. So you take that jelly donut and you squeeze it just a little bit, and a little bit of the material comes out the back. We know it's a bulging disc. We know the chemicals that come out of the disc have a lot of toxins in them, and they're very inflammatory, make you hurt, okay? A herniated disc, if you take that same jelly donut and you go like this, all the material oozes out and bathes the nerve root, and that's when we typically start seeing changes in bile bladder changes, maybe see loss of muscle function, or we start having loss of reflexes.
Yeah.
So Kayla's going to talk about some treatment options for you, so here we go.
Yeah. So based on your disc bulge or herniation, whatever you have going on, there's definitely a directional preference of what we call it in chiropractic. So you're either going to want to go forward or you're going to want to go backwards. So a lot of times going forward helps patients, but sometimes leaning back does. So what I'm going to do is I'm going to show you a couple quick exercises. They're called McKenzie flexion extension, of what you can do at home if you're having an acute case of this, or before you come to see us, right, Doc?
Right.
So if you prefer and you feel better when you go backwards, I'm gonna have Keisha put her hands on her back of her hips, just like this, good. And all I want you to do is lean back, just like that. You're gonna go right back forward. So she leans back, she holds it 3 to 5 seconds. That can help give a little bit of pressure. If the disc is bulging backwards, it's going to help push it back into the place where it needs to go. Now, if you like to go forward more, or whenever your back hurts, you're leaning forward like this, we're gonna have you do a McKenzie flexion-based exercise. So lay on here real quick for Miss Keisha. So the first step for this is, if you're laying in bed or laying on the floor, or laying on the couch, whatever's comfortable for you, you're gonna straighten out both of your legs for me. And all you're gonna do is she's gonna bend her knee, and you're gonna hold that with your hands, and you're gonna hold that position just like that. Hold it again, 3, 5, 10 seconds, as long as it feels good, and then you're gonna release it, and that will help alleviate some of the pressure on that disc space. These are much more advanced, and we go through a lot more of these progressions in the clinic, but this is a quick way of things that you can do at home whenever you're suffering from an acute of that nerve pain that you're having with the disc. So if you're having pain with this, or you know someone, give us a call, 252-430-8000.